Now, you mentioned briefly isotretinoin as a treatment for that severe acne. Accutane is what it's commonly known as, but the brand that is known as Accutane was actually removed from the market a number of years ago. And so isotretinoin is the generic name, and it appears on the market under several different trade names, which have, as far as we understand, the same efficacy, with perhaps one exception. But Accutane has a bad rap in many respects because of the reasons under which it was withdrawn from the market initially. It is used all over the world, and we still use it. In my experience, I prescribe it nearly every day, but it has a lot of misconceptions and myths associated with it. Can you kind of walk the listener through what might be some of those common myths that they could ask their dermatologist about before flat out deciding I will or I will not take a prescription of isotretinoin?
Yeah, so the first thing, most people don't even know what the risks of isotretinoin are. They've heard that isotretinoin, that's a really strong medication for acne, and they just assume that there are all these risks associated with it, but they don't even know what the risks are. They just assume that it has like a ton of side effects. It is a strong medication. The biggest side effect that people will 100% see with Accutane is dryness, and you can manage that easily in consultation with your board certified dermatologist. The dryness is definitely manageable, and there are techniques that your dermatologist can teach you. There is a very, very small risk of depression. It's controversial. Some people think it's real. Some people think it isn't real. I do believe that there is a small risk of depression with Accutane. It probably is much, much lower than originally thought. I'm hesitant to put numbers to it, but I would guess maybe 1 out of every 2 to 5,000 patients. I have seen it once or twice in the number of times that I've prescribed Accutane, but that's about it. Aside from that, any medication can have side effects. The only other thing that's really important to remember about Accutane is that you absolutely cannot get pregnant while you're taking it. So if you are a woman of childbearing age, you do have to be on birth control while you're taking it. But, 1 month after you stop, anybody who hypothetically, wanted to get pregnant, you can.